Good afternoon, and thank you for your opportunity for presentation. No disclosures. Aim of study to examine the effect of the 2-year dietary manipulation GM in stable patients with interstitial cystitis. IC. Design, material, method. This study included 40 female patients, and we did the original IC diet and randomly assigned 30 patients with instructions to follow this diet and intensive systematic dietary manipulation ISDM, and 10 patients without instructions, non-intensive dietary manipulation NIDM. And removed or restricted foods are as follows: tomatoes, spices, or potassium-rich foods, stress, strong acidity, caffeine, carbonate, hydrate, etc. And the evaluated parameters are the O'Leary scent, symptom and problem index, urgency visual level scale, bladder pain bath scale, and quality of life, and macroscopic intravesical findings from the start of the treatment and 2 years after treatment. And the background, no significant difference were observed in the background factors of the both groups between ISDM and NIDM. And the ISDM showed a significant improvement in all assessment items in the first 3 months, and further significant improvement at 1 and 2 years, including pain. And the NIDM showed no significant improvement in the first 3 months, or the worsening trend was observed in all items at 2 years. Circle is pain change. And this is some cases of the ESSIC type 2C after 24 months, complete cured, and type 3C, lower column, completely cured. Type 3C, completely cured. Type 3C, lower column, improved. And type 3C, upper column, cures, and type 3C, lower column, after 2 years, cured. And type 3C, left lower column is the NBI, completely cured. Conclusion: ISDM relieves various IC symptoms, including pain, for more than 2 years and improves quality of life. The effect was judged to be due to the improvement of the intravesical environment. Thank you for your attention.
Well, intensive diet is quite hard to keep up during a long time, isn't it? How did you ensure that the patient actually were continuing the intensive diet?
Yeah, probably the
Were you encouraging them along the way, or did you monitor, or they all were eating true to the intense diet? You know that.
The important thing is that patients themselves can feel the change of pain or
so that was encouraging.
Or frequency or urgency. By themselves, and can continue the dietary manipulation. Go back to you.
Thank you. Thank you very much. My name is Svanberg from France, and thank you very much for a very interesting presentation. What was your underlying assumptions or your hypothesis for the choice of food not to eat? There was tomato and tofu and spices, and it was a good blend. Why did you choose those ones and not something else?
The very restricted food is varied by patients, exactly, but very acidic or the spices and tomatoes or any other should be lowered. And the details composition with the patients and the tailor-made diet can made and continues at the ISDM. intensive systematic dietary manipulation.
So to reduce acidity of the diet.
Yeah, acidity. Oh, yeah.
But wouldn't the gastric fluid be more acid than anything you would eat anyway? So with a pH of 1 or 2 in your gastric fluids, does the
Yeah.
absence of tomato matter a whole lot? I'm just curious to try to understand because it passes through the gastrointestinal tract, goes into the bladder, gets filtered in the glomerulus, and then goes out in the bladder. So it's done a little bit of first, second, and third passage before it gets there.
Because the degree of the symptoms, but the varies by the same food, Yeah, for the HANA versus patients. And we do not determine the exact menu, but varies by the patients. And for the long time, continuation of the diet manipulation is very important for patients themselves. Tailor-made, okay? Yeah, thank you.
Thank you for your
last
yeah,
question.
thank you for interesting presentation.
Yeah.
So, what do you mean by stable interstitial cystitis? Stable in terms of what? I mean, the attack of the pain, the general condition of the patient, the use of painkillers. What do you mean of a stable IC?
I beg your pardon?
I mean, in your inclusion criteria, you mentioned the case of interstitial cystitis, stable interstitial cystitis, right?
Yeah.
Okay, so what do you mean by stable? Can you please explain? If you explained it, I missed it. I didn't.
Stable disease.
Stable disease. What do you mean by?
chose patient with stable disease.
Stable the conditions or the urgency, the pain, and the
So, in terms of floods,
After
associated
hy- after-
floods
after-
and pain together.
that's all. After hydrogestion or the DOL of the bladder, and the stable stage of the disease,
Okay, so if the disease is already stable, why would you choose those patients to enroll them in your study and do this significant dietary change?
For us, almost most of the patients improve symptoms after hydrogestion or transversal resection, and entry this dietary manipulation. You understand?
Sorry.
After operation, hydrogestion or TUR,
Yes. Yes.
and after for about 2 or 3 months later, the conditions just become stable
Yes.
and entry to the
Then you will enter.
year.
Okay.
Understand?
Happy? Almost a little bit. So I think we have to proceed if you're not going to explain
Very,
it.
very short question. The cystoscopy you showed to us is in the stable condition or before that, or before treatment?
Yeah. Before operation.
Before operation.
Sure.
And after the bladder is stable, then you proceed with the restricted diet.
Yeah, right.
Okay.
Okay, thank you very much.